Colorectal cancer was once considered a disease of older adults, something that developed slowly over decades and typically emerged in the sixth or seventh decade of life. But that landscape is changing, and not for the better. In recent years, rates of colorectal cancer in adults under 50 have surged, startling physicians, devastating families, and revealing a hidden epidemic rooted in lifestyle and systemic neglect. Among the many risk factors, one stands out with disturbing clarity: obesity. Obesity is no longer just a long-term health concern. It's now a direct threat to people in their 30s and 40s. What was once a warning for the future is now a pressing danger in midlife. The biology behind this connection is deeply troubling. Excess fat tissue, especially visceral fat around the abdomen, acts like a rogue endocrine organ, constantly releasing pro-inflammatory cytokines, altering gut microbiota, and driving insulin resistance. These biological changes create the perfect conditions for colorectal cancer to develop and progress more aggressively. Insulin resistance and elevated insulin levels, both common in obesity, promote cell proliferation and reduce apoptosis, or programmed cell death. That means abnormal cells, once formed, are less likely to be cleared by the body and more likely to survive and multiply. In the colon, where rapid cell turnover already occurs, this imbalance accelerates the chances of DNA damage, polyp formation, and eventually malignancy. Chronic inflammation, another hallmark of obesity, also plays a direct role in colorectal cancer risk. Inflammatory markers damage the intestinal lining and create a hostile environment that favors tumor initiation. Meanwhile, disruptions in gut microbiome, shaped by poor diet and obesity, reduce the production of protective short-chain fatty acids like butyrate, which normally suppress tumor growth. Together, these processes silently transform the colon into fertile ground for cancer. What's particularly alarming is that young adults are often unaware they're at risk. Colorectal cancer in people under 50 tends to be diagnosed at later stages, not just because it's more aggressive, but because it's not expected. Symptoms like rectal bleeding, abdominal pain, or changes in bowel habits are often dismissed by patients and even by clinicians as hemorrhoids, stress, or dietary issues. By the time testing occurs, tumors have often spread beyond the colon. Screening guidelines have only recently been updated to recommend colonoscopies beginning at age 45 for average-risk individuals, but many under that threshold, particularly those with obesity, remain undiagnosed until it's too late. This delay is fatal. Early-stage colorectal cancer has a survival rate of over 90%. Late-stage? Closer to 14%. Obesity is one of the few modifiable risk factors for this disease, yet very little is being done to aggressively address it, especially in the age group now most vulnerable. The food environment continues to push ultra-processed, low-fiber, high-fat diets that directly contribute to both obesity and colorectal cancer risk. Sedentary lifestyles are normalized, and preventive care remains a privilege, not a universal standard. The danger here is compounded by a cruel irony. Many of those at highest risk for early-onset colorectal cancer, low-income individuals, people of color, and those living with obesity, are also the least likely to receive early screening or dietary counseling. They are underinsured, underserved, and often unheard by the medical system. The disease progresses not just in their bodies, but through the silence that surrounds their risk. Colorectal cancer, in midlife, is not a mystery. It's a reflection of decades of damage from processed food, physical inactivity, rising obesity rates, and healthcare inaccessibility. We know the cause. We know the biological pathway. And still, we continue to let it spread. If trends continue, colorectal cancer could soon become the leading cause of cancer death in young and middle-aged adults. The time to act was yesterday. But without radical intervention, in screening, in prevention, in food policy, and in public health messaging, we're left with a generation quietly moving toward diagnosis and death, too young to be prepared, and too often dismissed until it's too late.